Good day everyone, I am Siti Raihan M. Monte, and in this video, we are going to talk about the World Patient Safety Day. So, what is patient safety? Patient safety is a healthcare discipline that emerged with the evolving complexity in healthcare systems and resulting rise of patient harm in healthcare facilities, and it aims to prevent and reduce risks, errors, and harms that occur to patients during provision of healthcare. A cornerstone of discipline is continuous improvement based on learning from errors and adverse events. So why does patient harm occur? A mature health system takes into account the increasing complexity in healthcare settings that make humans more prone to mistakes. For example, a patient in hospital might receive a wrong medication because of a mix that occurs due to similar packaging. In this case, the prescription passes through different levels of care, starting with the doctor in the ward, then to the pharmacy for dispensing, and finally to the nurse who administers the wrong medication to the patient. So, the burden of harm. Every year, millions of patients suffer injuries or die because of unsafe and poor quality of healthcare. Many medical practices and risk associated with healthcare and emerging as a major challenge for the patient safety contribute significantly to the burden of harm due to unsafe care. And the next is medication errors. These are leading cause of injury and avoidable harm in healthcare systems. Well, globally, the cost of associated with medication errors has been estimated about $42 billion annually. And healthcare associated infections. This occurs in 7 and 10 out of every 100 hospitalized patient in high-income countries and low and middle-income countries, respectively. So next is unsafe surgical care procedures. These cause complications in up to 25% of patients. Almost in 7 million surgical patients suffer significant complications annually, and 1 million of whom die during or immediately following surgery. So next is unsafe injection practices. In healthcare settings, it can transmit infections including HIV, hepatitis B and C, and pose direct danger to the patients in healthcare workers. They account for a burden of harm estimated at 9.2 million years of life lost, disability, and death worldwide, known as disability adjusted life years daily. So next is unsafe transfusion practices. Expose patients to the risk of adverse transfusion reactions and the transmissions of infections. So the data on adverse transfusion reaction from a group of 21 countries show adverse incidence of 8.7 serious reactions per 100,000 distributed blood components. So next is radiation occurs. This involves the overexposure to the radiation and cases of wrong patient and wrong site identification. A review of 30 years of published data on safety and radiotherapy estimates that the overall incidence of errors is around 15 per 10,000 treatment cases. So sepsis. Sepsis is frequently not diagnosed early enough to save a patient's life because these infections are often resistant to antibiotics. So they can rapidly lead to deteriorating clinical conditions affecting an estimated 31 million people worldwide and causing over 5 million deaths per year. So venous thromboembolism or blood clots is one of the most common preventable causes of patient harm, contributing 1/3 of the complication attributed to there is estimated 3.9 million cases in high-income countries. So, When is a World Patient Safety Day celebrated? So every September 17, World Patient Safety Day calls for global solidarity and concerted action by all countries and international partners to improve patient safety. So the day brings together with the patients, families, caregivers, communities, healthcare workers, healthcare leaders, and policymakers to show their commitment to the patient safety. The resolution of WHA 72.6 Global Action on Patient Safety recognizes the patient safety as a global health priority and endorses the establishment of World Patient Safety Day to be observed annually in every September 17. So, for the World Patient Day, September 17, 2021, who urges all stakeholders to act now for safe and respectful childbirth, with the theme, Safe Maternal and Newborn Care. Approximately 810 women die every day from preventable causes related to pregnancy and childbirth. In addition, around 6,700 newborns die every day, amounting to 47 of all under 5 deaths. Moreover, about 2 million babies are still born every year, with over 40% occurring during labor. Considering to the significant burden of risks and harm of the woman and newborns are exposed due to unsafe care, compounded by the disruption of essential health services caused by the COVID-19 pandemic, and the campaign is even more important this year. So there are 4 objectives of World Patient Safety Day. So first is this is to raise global awareness on the issues of maternal and newborn safety, particularly during childbirth. And second is engage multiple stakeholders and adopt effective and innovative strategies to improve maternal and newborn safety. And third is to call for urgent and sustainable actions by stakeholders to scale up efforts, reach the unreached, and ensure safe maternal newborn care, particularly during childbirth. And lastly is to advocate the adoption of best practices at the point of care to prevent avoidable risk and harm to all women and newborn during childbirth. So let's proceed to the next one. So, who started the patient safety movement? So, Joey Kiani started the patient safety movement because the patient safety movement's goal of zero preventable death is announced at the Clinton Global Initiative by founder and chairman Joey Kiani. Inaugural Patient Safety Science and Technology Summit is sold out and draws over 300 attendees. So next is World Patient Safety Day is also celebrated throughout the theme slogans, quotes, wishes, messages, and posters. So here are some of the slogan, quotes, wishes, messages, poster that was made when it was celebrated in September 17. So that's it in today's video. Thank you for watching, and I hope you learned a lot in my video.